So right from Wednesday, I hope that you've been well, blessed of the Lord, very happy and healthy. And if you're not healthy, we pray that the blood of Jesus will heal you in Jesus' name. Yes, because we received healing when our Lord Jesus Christ died on the cross. Right? Yeah. So karibu sana. This is MBC ITV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is the one and only Afya Clinic, where we talk about everything health. So feel at home. We're going to learn so much today. But even before I tell you what you're going to be doing today, is that feel welcomed. Our numbers are very open. And before we even get into the actual health topic that we'll be talking about today, is that I'd want to know how your week has been. What are you thanking God for? Una to watch kutoka wapi, una to watch na kina nani. And all these will be coming through our numbers, which are very open, as I said before. 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We are live on Facebook on MBC ITV Facebook page. We're live on YouTube on MBC ITV official YouTube page. All right, so feel at home on all those social media pages. We'd want to know how you are faring on, what you're thanking God for. Unafila leo, do you have something that you're thanking God for? We say that every day is a day for Thanksgiving. So tell us, what are you thanking God for this particular morning? And we'll be ready to hear from you. On all social media pages, ukienda pale utafute Rachel Kahugu, you'll be able to get me, and then text me or send a message. I'll be able to get you loud and clear. All right, today we're talking about blood infection. Yes, we're talking about blood infection. And I know we have mentioned blood infection so many times on this show, and we said today it's very important for all of us just to get to understand what blood infection is and how would your blood get infected. What exactly is that? And this is a very sensitive topic for me as well, because last year, was it last year? Yeah, it should be last year. I had shared right here when you slightly mentioned about blood infection that even me as a person, and I really love, I'm careful with what I eat, I'm careful with my health, but I also got the blood infection, and it was serious. It was serious, guys. You remember we were talking, it was actually a conversation with Committee on Air, and you were saying that karibu tukule mchele, yeah, and now I was wondering, we have so many people talking about blood infection. Why is it that serious? How do people get blood infection? So we'll be talking about that. So if you have any question in regards to that, please feel free to ask. Our doctor will be joining us in a very short while. But before that, I'd also encourage you to send in all the other topics that you'd want us to talk about on this show. Maybe leo tunaongelea blood infection, but you have something else that you'd want to gain more knowledge about. Yeah, so whatever it is, any type of cancers, maybe you want for us to talk about diabetes, for you to get more knowledge about it, this is the place where you tell us about all those topics, and then we'll be slotting, of course, a day, hopefully very soon, God allows, so that we can talk about all those topics. But today, we are talking about blood infection. So once again, karibu sana. My name is Rachel Kahugu. Very happy and delighted to have you here. I can't wait to hear from you and to know how you are doing. Once again, our numbers are 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBC ITV Facebook page. We're live on YouTube on MBC ITV official YouTube page. So on all those social media pages, we'll be able to get you, and of course on all social media pages at Rachel Kahugu. Ukitext pale, nitaweza kupata ujumbe wako. But for now, I'd love for us to get the in history segment so that you can get to understand the history of blood infection. And then immediately after that, we'll be coming right back to read your feedback, but also to have this discussion with our guest. For now, let's get the in history segments.
Blood infections, including sepsis and bacteremia, have been a major medical concern for centuries. In ancient times, physicians like Hippocrates and Galen identified infections but had little understanding of the role blood played in spreading diseases. Treatments were often basic and ineffective, relying on remedies such as herbs or harmful practices like bloodletting, which sometimes worsened the condition. The role of bacteria in the bloodstream wasn't recognized until much later, fundamentally changing the way infections were approached. The 19th century was a turning point in the understanding of blood infections, thanks to the work of pioneers like Louis Pasteur and Robert Koch. Louis Germ's theory in 1857 and Koch's discovery in the 1870s established that bacteria and other pathogens could enter the bloodstream, leading to life-threatening illnesses. Joseph Lister's introduction of antiseptic techniques in the 1860s drastically reduced surgical infections, while physicians began to connect poor hygiene with the spread of infections. Despite this progress, the methods of preventing infections were still evolving. In the 20th century, the discovery of antibiotics, beginning with penicillin in 1928, revolutionized the treatment of bacterial infections, including blood infections. However, antibiotic resistance has become a significant issue in recent years, making it harder to treat bloodstream infections effectively. Today, modern medicine focuses on early detection through advanced diagnostic techniques and developing new treatments to combat resistant bacterial strains. Despite this advancement, blood infections continue to pose a serious global health threat, especially for vulnerable populations like the elderly and those with weakened immune systems.
All right, so that is it on the In History segment. So you've gotten to understand the history of blood infection. So as we are getting into the conversation, we'll be getting to answer some of the questions that are already coming in about blood infection. But at least you have just a glimpse of what that is and what's the history of blood infection. Yeah. And now on site, we're finally having your doctor. And this is a very good time for you to ask all those questions, because now we won't be using Dr. Google. Because we said here, surely, Dr. Google doesn't work. So we'll be having a professional counsel from a doctor. So today we are having Dr. Rogers. He's from Bali Hospital. And he'll be able to just help you understand more about blood infection. All right, so karibu sana to this discussion. Hi.
Hi.
How are you doing?
I'm quite fine.
Thank you so much for being here.
Thank you.
Yeah, we can't wait to just understand blood infection and what that is and how that happens.
Yes.
You know, kumekuwa na story nyingi sana around blood infection, and we want to clear the air and also, you know, clear some myths ambazo ziko around blood infection.
Okay.
But before we go there, please introduce yourself. That's your camera.
Okay. I'm Dr. Rogers Abida.
Yeah.
I am a resident medical officer at Valley Hospital. Yeah. Can I say this? Jesus Christ is my Lord and Savior.
Yes, please. Yes. Amen.
Amen.
Very important.
Yes.
Very important.
With the currently new trend of new diagnosis, when someone gets to a hospital and then they are told they have a bacterial infection.
Yeah.
So normally when you treat patients, they get to ask, hii ni nini, na ilikuja aje, na nini. So I usually address a patient one-on-one, but now at least I get to address a larger population of people.
Yeah.
So hopefully many people get to understand how it comes about.
Yeah.
Yes.
And you can't wait to, you know, just understand all about that.
Yes.
And I've loved that you've first of all started with Jesus Christ is your Lord and Savior, because on this show we say that we'll talk about all kinds of sicknesses and try to help, because that is why we have professionals. Yes. But even with all that, it is Jesus that heals. Yes. You know, it's just Him that has given us the knowledge. But you know, we'll do our part.
Yes.
Yeah, we'll do our part. Now let's start from the very beginning. In layman's language, what is blood infection?
Okay, so blood infection, it's something very broad.
Yeah.
But to make it a little bit brief, it means that you had an infection somewhere in your body, and the infection got to a point where it's so much to the point the infection spread into your blood.
Okay.
Yes. So for example, you might be having a simple infection on your chest, like pneumonia, and then the infection got so severe to the point now the infection has spread into your bloodstream, and it's now causing a whole systemic effect instead of just being in your lungs.
Okay.
Yes.
Now, how does that happen? How does it move from maybe your lungs to the bloodstream?
Okay. So how it happens, it's simple. It's through blood.
Yeah.
You know, our heart gets to pump and blood gets to move from one point to another.
Yeah.
For example, we have blood flowing into our lungs for us to be able to get oxygen, for us to be able to breathe. And then the oxygenated blood flows back to our heart to the rest of the body.
Yeah.
So usually just by blood flowing into these organs, which happens normally, that helps in spreading the infection.
Okay.
Yes.
Now, you've mentioned about the lungs.
Yeah.
As one of the places where you would have the infection that would, now cause the blood infection.
Yeah.
What are some of the other, bacterials or infections or type of infections that would now cause blood infection in the long run?
Okay, so usually there are specific regions or specific places in our body that when we get an infection in those places, you are more high likely to get a blood infection.
Yeah.
For example, lungs was the first one, and then you can also have your upper respiratory tract that starts from your mouth to your throat and to your windpipe.
Okay.
Yes. So when you have something like tonsillitis, it's usually a major cause. And then we also have our intestines. Yes.
Okay.
Our gastrointestinal system. So when you have specific diseases like you have diarrheal diseases, or you have typhoid, or you have any other infection that might cause problems on your abdomen, then it is high likely that it will also spread into your blood. And then the other one that is very common, especially in older people, is when you have a urinary tract, genitourinary tract system infection.
Okay.
So if you have a simple UTI, it can start at a simple UTI, and then with time it progresses to blood infection.
Okay.
Yes, that causes a lot of problems.
Okay.
So those are usually the main places. Though you can have an infection in your bones or any other place, but the most common ones are in your urinary tract, in your abdomen for your intestines, in your lungs, our lower respiratory tract system, and our upper respiratory tract system.
Okay.
Yes.
So how do you know that now, or rather, what are the symptoms of blood infection? How do you know now that this has graduated from a simple stomach infection or lung infection to a blood infection?
So usually it depends on how severe the patient presents. For example, I gave an example of the lungs. So someone comes to the hospital with a history of difficulty in breathing, and cough, and then it started, say, 1 week ago. The patient probably took amoxicillin, went to the clinic, went to a pharmacy or a chemist, was given just some medication. They took the medication, it's not working. The patient keeps getting worse. So now the symptoms graduate from just coughing and difficulty in breathing to a point now this person has headache, this person can feel his heartbeat is beating faster, this person can feel he's breathing even faster, this person can feel he's getting more tired, is feeling weak. Yes.
Okay.
Yeah. Some can even have cold extremities, like when you get to have your hands and your legs feeling a little bit colder than usual. Yes. So when you see such a patient, now you start thinking there is probably an element of the bacterial infection worsening.
Okay.
Yes.
Now, we'll come back there, not to digress, but you mentioned about you'd feel like your hands and your feet are a bit too cold than normal. We were having that discussion the other weekend. You were asking, I saw some people were asking, pia sisi hapa kwa studio, we were having that conversation, and you were asking, what's usually the normal temperature? Because the people, when they have like their feet and their hands usually a bit too cold. Is it usually normal?
Yeah, there is a certain group of people that their extremities are usually colder than normal. So when you get to even touch their legs, they are cold. So that can be like a variation from normal. Like it can also fall within the normal. But now imagine if your hands and legs are usually very warm all through, and then now for the first time, because you are sick and you are feeling overwhelmed, now your extremities are cold. Now that is when it gets to be a concern. Yes.
So you have to know your normal.
Yes, you have to know you are normal. So ukifika huko naambia daktari akikuuliza mguu na mkono inakuanga hivi, like nimezoea hivi, or today is the first time. Yes.
Is it different with blood groups or your blood type? How different is it? What are these kinds of people? Because you said there's a group of people.
Yeah.
When for them, they're usually more colder than others.
Yeah.
How different is it?
So
what causes that?
It's not. It has never been listed even medically that there is a group of people or with a certain. There is no specific thing. It's more about how that person usually feels. But there is nothing. There is no determinant like say your blood group or. Any other thing, or like being a man or a woman or a young, old, there is no usually a determinant.
Okay.
Because it depends person to person. And also it depends on your habits. For example, if you get to put on sandals in a cold environment, your feet will most likely be cold. But if you like putting on shoes and socks, your feet are likely to be warm.
Okay.
Yes.
Okay, works well.
Yeah.
Now, let's go back to the symptoms of blood infection.
Yeah.
We've talked about for example, you're having an issue with your lungs, and then with time, it gets a bit more severe.
Yes.
So for blood infection, is it usually different from what is the cause of the blood infection? Are symptoms there? Are they the same?
Now, symptoms, it depends also, because someone can just come and say, for example, there is no infection in your lungs now. Someone just comes and say, Doc, I have a headache. I'm also feeling fatigued.
Yeah.
I don't know what's happening. Yes, I've just come for you to check. So you do this basic test and then you come out that there is an infection in blood.
Yeah.
So the signs and symptoms vary from one person to another. You can be having a particular symptom of the source of the infection.
Yeah.
For example, if you're having, the lungs I've used so much. So for example, if you're having abdominal issues, so you can be having episodes of loose stool, but now when you come to the hospital, you are overwhelmed and then there's something, and then now from the symptoms getting worse, we get to do the test and we establish the infection has also spread. But then now there's the other group of people where someone just comes, they don't have any symptoms. The person was just okay yesterday, today they feel they have a headache that is not normal, today they feel they are tired, today they feel their heart is beating fast, no symptoms whatsoever. And then now from there you do the investigation, we establish there is an infection.
Okay.
Yes.
Okay. Now, are there people who are more at risk of getting blood infections?
Yes. There's specific groups of people that are more at risk. For example, if you put age to be a factor, younger children below 2 years and the elderly above 65 years are more likely to have bacterial infection in blood. Yes, compared to from 3 years up to around 65. So that is around the normal group. But how young you are and how old you are is a determinant.
Okay.
Yes.
Why is that?
Maybe you are young enough, your protection hasn't gotten to a good enough level. And the more you age, the more now they usually just say being old is a risk factor for several diseases.
Okay.
Is that
like your immunity?
Yeah.
Okay.
It's a little bit about immunity, but age is the determinant factor.
Okay.
So that is one factor we look at. Then the other one, if you are immunocompromised. Immunocompromised, to say you can probably maybe having HIV/AIDS. You might be on medication. There are some medication. For example, if you're on chemotherapy medication, your immunity will get low.
Okay.
And then there are some very common medications that when someone takes for a long period of time, they lower your immunity. For example, prednisolone. It is a drug that is common. Those with asthma and several conditions, they usually prefer prednisolone. But on a long-term basis, it lowers your immunity.
Okay.
Yes.
Oh, wow.
So there's medication. And then...
So let's just go back there, Kidogo. Is there an alternative to that? Because if you're taking a medication that lowers your immunity, then there has to be an alternative to that.
Yes.
Or how do you go about it?
Yeah, there are usually better alternatives.
Okay.
Yes, and sometimes the medication works for specific conditions, but you have to give it for a short duration of time. So you don't give it for a longer period. But now someone will know that when they go to the doctor for consultation. But you find nowadays in Kenya, when you feel sick, you go to a chemist and hey, nipe ile dawa. And then the chemist, because they are running a business, they will give it to you.
Yep.
And now
using Dr. Google as well.
Yes.
Yeah. We need to do better there. We are kids.
Yes.
Uh-huh. So there's people who are immunocompromised and the age factor.
Yes, and then also the other thing else, there are some specific conditions that when you have, you are more predisposed to having bacterial infection. For example, if you have diabetes, diabetes impairs your healing ability. So if you have diabetes, your chances of getting bacterial infection from simple infection is very high.
All right, all right. So what do you do in such cases, assuming you have diabetes or you're much older or for a younger kid? What do you do just to make sure that you don't get blood infection?
Whenever you feel you are starting to get sick away from the normal, you go to the hospital, you go get checked. Because if it is detected early before it becomes worse, then you can get treatment. And then now it usually starts from a simple bacterial infection, and then it can go worse to something called sepsis, which is now very complicated. Yes.
Which is what exactly?
Now, you can be having a bacterial infection. For example, say you had an infection on your lungs, or you had a UTI, urinary tract infection, and then it has progressed to bacterial infection. And then while it's there progressing to a bacterial infection, it gets worse. For example, now the bacterial infection gets to be so high to the point now your body starts reacting to it. So now with sepsis, there's usually a normal reaction. For example, if you have an infection in your lungs, your body will produce some things that will help try and fight the infection. But now when it gets to sepsis now, there is a dysregulated response to it. So instead of the body trying to bring about the necessary, it's called cytokines and the rest. I don't want to confuse anyone who is not a doctor. But instead of the body reacting to it in a normal way, the response gets to be a dysregulated response. And then as a result, it can also lead to end organ failure and a lot of other things. So usually when someone has sepsis, it can go to the point when someone also gets to have septic shock, which now this person will probably benefit from being in a HDU or a ICU, and it all starts from a simple bacterial infection.
It would be that bad?
Yes.
So it's very important for you to go get checked as early?
Yes, as early as possible. When you feel that you are not feeling okay, when there's something out of the normal, it's just testing. You go to the hospital, you get tested, and then now you get put on the right medications as early enough, and you get to be better. Especially if you are at risk, if you have some of the risk factors. Yes.
Now, would someone get better by self-medication if you know where the problem is? Because I know that people who have recurrent blood infection, and we'll be talking about that, people who get blood infection from probably abdominal issues. So first time they get treated, second time they get treated, and that time they already know, inelo ugonjwa. So is it possible for them to, get better by self-medication?
Yes. They say Mungu ni wetu sote. Yes, and God loves us. But when, say, you have been having a recurrent issue, like you had a bacterial infection last time, you got given this medication. You had it again the second time, you got given this medication. Now the third time you say, I have the same symptoms as last time. Let me go get that medication that I was given. So it can work. It can work, but sometimes it might be more than the infection, but it can work, and it works a lot. You find nowadays someone is sick or having diarrheal issues, someone goes, nipe flagyl. Yes, sometimes it works. Yeah, sometimes it works, sometimes it don't. It doesn't work at all. So
why gamble? Go to hospital.
Yes.
And thank you. All right. Now, we'll be looking at some of the Mythbusters, but before we do that, we'll be going through some of the questions that are coming in. And I'd just like to remind you that today we are talking about blood infection. So all the other questions that are coming in, tutakuwa tukizisoma baadaye, or the comments, which is really amazing that we have a lot of comments, tutakuwa tunazisoma baadaye. But for now, I'd love for us to talk about blood infection, and I see we have questions as a blood infection coming in. I'll just remind you that our numbers are very open. On WhatsApp, it's 0721 105 105. 23814, our SMS code, which is absolutely free. We are live on Facebook on MBCI TV Facebook page, and we're live on YouTube on MBCI TV official YouTube page. So on all those social media pages, we'll be getting your feedback. Now, and only the hello. Now she is she's a lady, and I say, hello and good morning. And I say, I was scratched by a cat while playing with it. Can it cause blood infection?
Now, being scratched by a cat or any other animal by itself is usually dangerous because of the infections you'll get.
Okay.
Especially, say, if it's a dog and also cat. These animals, they get to have rabies. So you can get rabies infection, but nowadays we are lucky there is anti-rabies, so you just go get an injection and then you'll probably be okay. Yes. But now if you, depending on how big the cut wound is, if the cut wound is big enough, then it can be an entry point for infections. So if the cut is big, if the scratch mark is big enough, you can get some slight antibiotics to at least avoid not getting bacterial infection. Yes.
All right.
But normally it's someone just gets the anti-rabies and you're okay.
Okay.
Yes.
Okay, I see.
Yeah.
Now we'll be getting to read more questions, but for now, I'd love for us to get to look at some of the myths that surround blood infection. Okay. Now, let's take a look at the mythbusters. The first one is that blood infections are always caused by bacteria.
Yeah, that is something that is very wrong. Yes, because though bacteria is the most common cause of blood infections, we also have viruses and then we also have fungi. Yes.
Okay.
So both of them, all the three of them can be able to cause blood infections. And now depending on severity, the bacterial infection, at least they make it to, they are the most common, and then they get to be severe. But then now the viral infections too can be severe, and then the fungal infection, for the fungal infection to get so bad in your bloodstream, then you probably has some, or you are immunocompromised, especially for the fungal infections.
Okay.
Yes.
Okay. I see.
Yeah.
Now let's go to the other one, is that blood infections are rare and they're not a big concern.
Oh. Yeah, that is also another myth. Blood infections are very common because it starts from a simple infection. For example, lungs, if you have tonsillitis, if you have diarrheal illnesses, if you have a UTI, these are everyday problems. Someone comes to the hospital and then they have a UTI. Someone also comes, they have these simple infections. But now when you test their blood, you find that the infection has spread to enough, it's starting to get into blood. So you give the patient at least some strong medication to help. But blood infections are common. If I'd say the number of people I see every day, those that have blood infections are the number is high in a way.
Oh, really?
Because blood infection, it's intertwined with all other infections. Yes.
Okay. So it's a huge concern.
Yes.
And people need to talk about it more and understand it more.
Yes.
Okay. I see. Now let's get to see the third one, which is the last as well, that says that blood infections only occur in hospitalized or severely ill patients. Yeah.
That is the part that you said only occur. Now that is the myth part. But now blood infections are more common in, they're actually more common in hospitalized or severely ill patients. Yes.
Why is that?
Because if, say, you are hospitalized, there is many hospital-acquired infections. Yes. For example, with your infection in the lungs, you can also have a pneumonia that is hospital acquired. And then those ones are usually harder to treat because you have to give more stronger antibiotics. Yes.
Okay. So how would you avoid that?
How will you avoid that? Now, being admitted in the hospital, there's probably something else causing your admission. So in such a case, if you get to have maybe hospital-acquired pneumonia, we usually just figure it out and we put the patient on the right medication, and then you get to be okay. But now, blood infections can occur in anyone, anyone, from a young baby to an old guy. Yes.
Okay. I see. Now, we'll be getting to know if we have the Vox Pops and if they're ready so that you can go through them as well. But let's continue with the questions. I see we have someone saying, hello, my baby started crying a lot. The cry was mistaken to colic, given medicine, but the cry intensified. She developed, really have a hard time saying this word. Seizure. Seizure.
Okay.
It's usually
seizure.
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 Seizure. Yes.
So, as a full hemogram was done and the infection was found. So what was causing that name?
What was causing the seizures?
Yeah.
Yes. So now, when it comes to children specifically, they are like a different group of people. Because they cannot talk, they cannot express how they're feeling, they cannot tell you, mama tumbo inauma. If they start speaking, they'll say tumbo or nini, depending on probably how you have trained them. So children, when they start having issues, they get to have, they cry a lot. Their language of communicating with us, they cry a lot, they refuse to eat, and then apart from refusing, they can get to have fevers, and now, and then they also refuse to play. So they don't play. It's not like they are refusing because they want to. It's because they are now very sick to a point playing does not interest them anymore. Yes. So that is how children, they communicate to us. So when someone is crying a lot, ideally you should take the patient to the hospital for them to be tested. But now, children, back again, they are a special group of people because children under 6 years, when they get to have high body temperatures, just fevers that are very high, it can also bring them to have seizures. And seizures are not something to joke about because they are severe, and seeing a small child go through that, it is also psychologically traumatizing to the parent, to any human being. When you see a young cute little baby having seizures and they're sick, it's not even okay for someone emotionally. So probably the diagnosis for colic for that patient was wrongly made. At least the patient should have gone to the hospital to earlier enough. When the baby starts crying, you just take the child to the hospital. At least she or he gets tested, and then from there you get to have a diagnosis, or they get to be put on medication earlier enough.
So generally, what causes seizure?
Now, seizures is another broad but now seizures in children, the most common cause for seizures in children is now febrile illness. If you have high temperatures or high fevers for children under 6 years, it's the #1 cause. But then now you can also have seizures if you have infections that involves your brain. For example, if you have meningitis, yes, and then you can also have seizures when your electrolytes are deranged. You see, hizo vitu tulifunzwa high school, chemistry, sodium, potassium, chloride, magnesium, calcium, we also have them in our body. So when the levels get to be high or low, now someone can have seizures. Yes.
So how different is it from convulsions? Is it the same?
Convulsions and seizures is the same. The words are synonymous. Yes. So if pronouncing seizures is hard, you can...
To me, convulsions.
Convulsions, yes.
Yes, please. All right. I see. So we still have questions coming in, but for now, we'll be coming back to read the questions after the break. But for someone who's been having recurrent blood infections, what would be the issue?
Now, it depends also with the risk factor. Because blood infections, they start from a specific organ, and sometimes they just start on their own. They say, from the research, they say around 15% of all blood infections, you cannot even find the original source of the infection. Yes. So now, if you are having recurrent blood infections, you probably need to try at least and establish the cause.
Yeah.
For example, if it is a UTI, or if it is a pneumonia, or if it is tonsillitis, you get to be examined well, you get to be tested adequately, and then you get to be put on the medication. It will help. But if the infection keep on recurring, you need to look for, where is it that I'm getting this infection every now and then?
Okay.
So if it is tonsillitis, which is also very common, you go get checked.
Yeah.
You get given medication, or even if it is tonsillitis, you can get done for tonsillectomy, where they remove your tonsils if it is causing a lot of problems.
Yeah.
Yes.
Okay. So at what point ndio mtu fike na you have to be hospitalized?
Now, it depends also. Being hospitalized depends on a lot of things.
Yeah.
But now we get to see how a patient is sick, and then we get to grade how the level of sickness, how this person is feeling. So we usually have a criteria for admitting a patient.
Yeah.
So when a patient falls within that criteria, then now we admit. And also, it depends if the person will be able to take oral medication. Is it dawa za kumeza, or if they cannot even be able to handle that. Yes.
Okay. So it's a whole range.
It's a whole range.
Okay.
Yes, but sometimes most hospitals, we do this work of caring for other people, and now it also depends. There's someone utapata akona homa, just a simple mafua flu, and then the person is just okay, just soldiering it out. There's a person atakuwa na homa, and you look at this person, you'll think, hey, this person is probably dying. Yes. So it also depends on the person's tolerance. If inakupeleka vibaya sana, you can be admitted.
Okay.
Yes.
Okay.
But utapata there's another person with the same thing, but hayuko admitted. Yes.
Okay. Does that vary with your immunity?
Yes.
Okay.
Yeah.
So what are you supposed to do to make sure that you have a strong immune system?
A strong immune system.
Yes.
So that is a lot, but it's interesting. For you to be able to have a strong immune system, you need to eat healthy, eat a balanced diet. Just a balanced diet.
Okay.
You make sure usiwache nyama, alafu unakula fruits pia, carbohydrates. You just eat everything, but you make sure it is balanced.
Okay.
And then if you think you are immune compromised, then you can go get tested. The most common source of being immune compromised right now in Kenya is HIV. So you should get tested as often.
Yeah.
And then you can have HIV and not be immunocompromised. Yes. Nowadays with the ARVs, they are so good to the point even your viral load can be up to 0, to a point you cannot even infect another person. So you take, if you are HIV positive, you make sure you take your medications on time and every day.
Okay.
And specifically on HIV, it's based on the research, it's getting better.
Yeah.
Currently there is a drug that they have just finished the research on, where you can be getting an injection twice in a year, instead of taking medication orally.
Okay.
So when that will be introduced in Kenya, I think it will solve a lot of problems.
But okay, I know that's a whole topic. There's a session we did for, like a full session for HIV and AIDS. Maybe if you don't want to check that out, please go on MBCI TV official YouTube page or Afya Clinic playlist. You'll get the specific ones. But for the people who are immunocompromised, not because they're sick, it's just that there's an issue with their immunity. Their immunity is just generally low. Yeah, the people like that.
Not as such.
Or not as such?
Yes.
Okay.
Someone might be thinking their immunity is low because they get frequent maybe mafua or other things, but it's not the case. You just find when the person comes, they get tested and all these things, it's just okay.
Okay.
And everything is functioning. It's just that they got another infection or they got reinfected quickly.
Okay.
Yes.
Okay. Perfect. That works well. But tumesema watu wakule vizuri.
Yes.
Which is very
just a balanced diet, and the rest your body will do.
Okay.
Yes.
What is apart from balanced diet, what are some of the other lifestyle behaviors?
Okay.
Or lifestyle, how people live that would help people with, not getting blood infection and just making sure that their immunity is, is good.
It's good.
Yeah.
So smoking, you should avoid smoking.
Yeah.
Yeah, because smoking also, it helps lowering down your immunity and it impairs healing. And then there's also taking alcohol. So najua hii itaharibu watu wengi, but now alcohol, the more you take alcohol, the more your immunity also get a little bit low. So
if I just don't take alcohol at all. Yeah.
Yes.
Okay. So apart from drugs,
smoking, drugs, you eat healthy, you'll be okay.
Yeah.
Yes. Exercising
that
also helps. It just helps, keeps you fit. It helps your body gets to be good.
Okay.
Yes.
Okay.
So that also helps.
All right.
And exercising is not walking from here up to town and say, oh, I have exercise.
Yeah.
For exercise to mean something. Yeah. For exercise to mean something, you have to be doing something that involves you sweating, and it has to be for around 20 to 30 minutes. Now that will be something significant.
Okay.
Yes.
Okay. So for people who like to gym, or for, we have people who say no, they don't like to exercise because, their BMI is not even there yet.
Yes.
How do you go about it? Because now then exercising.
You just start small. You do what you can.
Yeah.
And you leave the rest to God.
Okay. Leave the rest to God.
Yes.
I'm thinking we'll have a full episode on healthy living.
Yes.
Because that's something else altogether.
Okay.
Now, we're just about to go for a very short break, but before we do that, I'd love for us to get healthy living, because now healthy living helps you to, just understand how to live healthy. And on today's healthy living, we'll be looking at how to, avoid getting blood infections. And now with Sylvia Wanja is that she tells you everything in details. Now we're having this particular segment from Sylvia Wanja, and then we'll be coming right back. Sindemali.
Hello and welcome to Healthy Living. My name is Sylvia Wanjar. Today we are going to be talking about preventing blood infections. Blood infections, also known as sepsis or bacteremia, occurs when harmful bacteria, viruses or fungi enter the bloodstream. They can be life-threatening if not treated promptly. Here is how to prevent them. Number 1, maintain good hygiene. Wash hands frequently with soap and water, especially before eating or after touching surfaces. Use hand sanitizers when soap is unavailable. Keep wounds and cuts or scrapes clean and covered until healed. Number 2, prevent hospital-acquired infections. Ensure healthcare workers use clean gloves and sterilized equipment. Regularly change and properly care for catheters, IV lines, and other medical devices. Request frequent cleaning of hospital rooms and medical tools. Number 3, get vaccinated. Vaccines help prevent infections that can lead to sepsis such as pneumonia, influenza, meningitis, COVID-19. Ensure children and adults stay up to date with vaccinations. Number 4, treat infections early. Seek medical attention for persistent fevers, chills, rapid breathing, or confusion. Follow the full course of prescribed antibiotics to prevent bacterial resistance. Never ignore untreated infections such as urinary tract infections, UTIs, pneumonias, or skin infections. Number 5, maintain a strong immune system. Eat a balanced diet rich in vitamins, minerals, and antioxidants. Stay hydrated and get enough rest. Manage chronic conditions like diabetes, as high blood sugar increases infection risk. Number 6, safe handling of medical equipment. For people with catheters, dialysis, or IVs, keep insertion sites clean and dry. Ask healthcare providers about proper hygiene and dressing changes. Number 7, be cautious with needles and injections. Only use sterilized needles for medical procedures. Avoid sharing needles or personal medical supplies.
So that is it about healthy living by Sylvia Wanja, and that was so wholesome.
Yes.
What would you say about that?
It was excellent.
Iko sawa?
Yes.
Okay, perfect. It's very good for us to get from you sikuwa na mahali.
Yeah.
All right. Now, Sylvia has talked about, and you had mentioned as well, about the hospital inquired. That's the name, right?
Hospital acquired
infections.
Yes.
And she's talked about needles, about, just making sure you are in the right environment.
Yes.
And that is much on the healthcare workers, because surely the patient is sick akotoka kwa kitanda,
Yes.
you know. So what are some of the things that while you getting admitted to hospital, you're supposed to be careful about, just to make sure that you won't go to hospital and then come out even worse?
Oh, now, as a patient?
Yeah.
Okay.
Do you have control over it as a patient?
As a patient, I don't think you might have control, but it's a little bit.
Yeah.
It's not much.
Okay.
But as a patient, you make sure you have sanitized. You at least try and keep your own personal hygiene as much as possible.
Yeah.
And yeah, in as much as you are sick, you try and eat healthy. Yes, but the others, it's up to the hospital and then the healthcare workers, Akina Sisi. So we'll make sure when we are treating you, we are not sharing needles and all that. Yes.
All right.
In fact, sharing needles is, I think, of the past, I think, currently.
Yeah.
Because with the emergence of HIV and AIDS, among the most common route of spread in 1990s there was probably sharing the infection, needles and all that.
Yeah.
So all that has been eliminated. I think up to now, there is no one who can get an infection from hospitals, which is a good thing.
It's a good thing.
Yes.
That's a good thing. That's some good news.
And
Now,
then also as a patient, you know, when someone gets sick, anakuja kutembelewa na kijiji yote, they get to see, huyu ako aje nini. And those people, each and every one of them will have interacted with other people somewhere, and they might be bringing along other infections. So maybe you try and limit the number of people coming to see you in the hospital.
Okay.
Yes.
Okay. Na hiyo ndio wapendi kusikia. Like, why don't you want my people to come and see me?
Yeah.
But daktari, please do better.
Yes.
Yeah, I hear you on that. Anasema hashtag Afya Clinic, hello Kahugen daktari, hello. Anasema, is body odor a form of blood infection? Odor ama odor, depends. And how can it be treated? Anita Ann kutoka Miru.
Okay. So body odor is not a sign of infection. There are people have distinctive smells, and it's different. You'll find each and every person, they have how their own body smells, and then it's very different from one person to another. And it does not mean that that when mchafu or any other thing else, it's just how your body smells. For example, if you haven't put on any cologne or anything, and you go close to someone who is close to you, you'll find they have a distinctive smell that is different from yours. So body odor is not a sign of sickness, yes, or bacterial infection. So to maybe say, if you are not comfortable with your body odor, you can get help, cologne. Yeah. Yes.
But is there a way that, because I understand maybe what they're asking is that there are people who are a bit extreme, like their body odor is a bit extreme, and they feel a bit uncomfortable with that. So is it a medical issue? Could it by any chance be a medical issue?
So now, body odor by itself, if it gets to a point where it's extreme, there's probably something. Because our natural body smells usually doesn't come out to the next person as care if someone is sitting, for example, the way you are sitting from me. So if you had a body infection that I can get from this side, there's probably something up. Yes.
Okay. So what would be the something? Now for that, it's a whole range. You have to go to hospital.
It's a whole range. It also depends on your age and your gender also.
Okay.
So if someone has a body odor and from a range you can feel the smell, so we tend to look at the most common places mtu anaweza kuwa na a smell. So you think of first the mouth. Brush meno. Do you have tonsils? Is there any other thing else from your throat that is causing problems? And then now we go to genitourinary system. Do you have an infection? And this applies to both men and women. Do you have a UTI? Do you have any infection or any other thing else that can be bringing upon that smell? And then from examining and all that, we'll come up with a diagnosis, or we'll do more tests, and then you'll get medication. You'll be okay.
Okay.
Yes.
I hear you. So go get checked. It's very important. We'll be giving you the numbers for Valley Hospital. That will help. Asema, hello. Does it mean if someone has pus cells, it's a bacteria infection? Okay. Has many pus cells. I don't understand what you're asking, but the second question is bacterial infection similar with blood infection?
Yes, so bacterial infection,
Yeah.
let me start with the second one. Bacterial infection and blood infection. Now, bacterial infection is just a type of blood infection.
Yeah.
Yes, you can get viral infection or fungal infection in your blood,
Yeah.
and those are other forms of blood infection. So it's not synonymous, but it's just part of it.
Okay.
Yes.
Okay, I see.
And then now when it comes to pus cells, now I'd understand because there's one test that we usually do.
Yeah.
It's called urinalysis for if someone, we get to diagnose if someone has a urinary tract infection.
Yeah.
So now on the test, they usually examine someone's urine sample on a microscope, and then they say, we have seen these several pus cells or numerous. So if you have numerous pus cells in your urinary UTI urinalysis results, it points more towards an infection. Why? Alafu, first, the pus cells is not synonymous to now having a bacterial infection, but if you have pus cells, it means you have uzaa tudogo to the point zinaonekana kwa microscope.
Okay.
Alafu zikikuwa mingi, uzaa ndio zikuwe inamaanisha kulikuwa na some infection, because it's like having, say, a boil that you can see the pus, but now the pus cells are tudogo mingi. So when you see the pus cells, ni just tuuza tudogo yenye inaonekana kwa microscope, and then hizo they point towards there being an infection, specifically a bacterial infection.
Okay.
Yes.
So if you have many pus cells, it means that most probably you have a bacterial infection.
A bacterial infection, and that being that it's a urinary tract system exam, so you probably have a UTI, a urinary tract infection.
Okay.
Yes.
I see.
And then now the UTI can spread now to be blood infection, and then now from there it can also go to sepsis, which can get worse. Yes.
Okay. Now we'll be talking more about sepsis because I see we have such questions coming in.
Yes.
But before we go there, is that apart from sepsis, how bad would blood infection be apart from the sepsis part? Because I see we have questions on sepsis. But apart from sepsis, how bad would it be? Would it maybe go to your HB going too low?
Now it won't even. It depends.
Yeah.
It depends. But if you have a blood infection, I don't think it will lead to your HB getting low.
Yeah.
Yes. It will just cause a lot of problems, but it won't lead to your HB being low. And then most of these infections, how they cause the problem is through sepsis now. Yes.
I see.
If it gets to be complicated to the level of sepsis.
Okay.
Yes.
Okay. Now, as we come back, we'll be talking about sepsis because that sounds like a whole other conversation.
Yes.
But we'll be talking about sepsis, then we'll be answering your questions as we wind up. But just to let you know or to remind you that this is Afya Clinic on a beautiful Wednesday morning. Thank you so much for being here, by the way. And of course, you're getting these from MBCI TV, where we transform lives by the grace of God. And we're very excited to have you here, and I hope that you are learning already. So if you have any question, please feel free to ask, and we'll be coming back to answer your questions on 0721 105 105 on WhatsApp, 23814. Our SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page, and of course we're live on YouTube on MBCI TV official YouTube page. So on all the social media pages, we'll be able to get your feedback. But of course, on all social media pages, you can apply after Rachel Kahungu. I'll be able to find your feedback. All right. So we're taking a very short break because it's top of the hour. As we come back, we'll be coming back to read your feedback. Senebali.
MBCI Television, transforming lives.
Juma hili tumeangazia hili.
Stooge ni aina fulani ya upendo ambao watu wanaweza kupendana. Una uungu ndani lakini hauna umahaba, hauna eros ndani.
Na hili.
Ukiangalia Shadrach, Meshach and Abednego in a foreign land, they had position, they were respected, they were honored. The king feared them.
Na hili pia
kuna venye tume interpret mapenzi in a different way venye haipaswi. Sasa unasema mapenzi ni kupewa pesa, mapenzi ni nywele itengenezwe, mapenzi ni nguo inunuliwe, mapenzi ni unipeleke na jet.
Tumeona mtu anakonda, anajikondea kabisa, anakaa mzeti kwa sababu ya mapenzi.
mazungumzo haya Maisha na Biblia ni kila Alhamisi saa 1:30 hadi saa 4 asubuhi. Yanakujia moja kwa moja na kwa wakati mmoja ndani ya radio na runinga wipendayo ya MBCI. Tunabadilisha maisha.
Are you passionate about the culinary arts? Do you dream of creating exquisite meals or managing a top-tier hotel? Welcome to Goshen Medical and Technical Training College. Our School of Hospitality and Catering Management enables our students' dreams to meet culinary excellence. We offer comprehensive programs in hotel and catering management, food and beverage production, sales and services, housekeeping and accommodation, culinary arts, pastry and bakery. Our experienced instructors will help you hone your skills and provide you with the knowledge and expertise you need to succeed in the hospitality and culinary industry. Our programs are recognized by reputable exam bodies such as NEC and NITA. Ready to embark on your culinary journey with us? Call us now at 0750-264-044 or 0723-047-468. You can also visit our website at www.goshencollege.ac.ke for more details.
Welcome to Goshen Medical and Technical College, Speaker. Yay!
Take the first step towards your future in hospitality and catering.
Are you looking for a structured way to grow spiritually in the year 2025? Start your year with Nuggets of Destiny 2025. Dive into daily inspired teachings designed to motivate, rebuke, and guide you in fulfilling God's mandate. Order your copy today. For orders in Nairobi and its environs, please call 0799 573 310. For delivery to any part of the country, please call 0721 510 050 or 0722 344 360. Alternatively, get your copy in person from any of our 4 main outlets. 1. The Gift Shop at Kingdom Seekers Fellowship, Nakuru. 2. The Gift Shop at Heaven's Gate Prayer Mountain, Gilgil. 3. Shop A, 22, first floor, Star Mall, Tomboya Street, Nairobi. 4. The Sales Desk at Kingdom Seekers Fellowship, Thika Road. To place your order today, send us a message right now and start the year 2025 equipped and empowered for spiritual growth.
MBCI Television, transforming lives.
Alright, we are back after that very short break, and of course this is MBCI TV ambapo tunabadilisha maisha by the grace of God. Thank you so much for being here. We do value your time greatly. Alright, today we're talking about blood infections. So if you have any question, please feel free to ask and we'll be getting back to you. I'm here with Dr. Rogers, who've been able to expound more on blood infections. So once again, asante sana for being here.
Thank you.
Yes.
Yes.
Now let's talk about, say, sepsis.
Yeah.
Yes. Now, what's that?
So now, sepsis is a complication of blood infection. So you start off by a simple blood infection, and then now it gets worse. So for you to have sepsis, there are some signs and symptoms that you have.
Yeah.
But before you even go to the signs and symptoms, what sepsis means is you have the infection in blood, and then now instead of your body responding to it the normal way, by producing some several, say, enzymes and some things called cytokines to help your body, now your body does not respond in a good enough way. Now your body will, it's called a dysregulated response to now the infection. Yes, because the infection got severe, and then now your body, instead of responding to it the normal way, it does not respond the normal way. It leads to, now the response is dysregulated, and then as a result, it can even get to be so bad to the point you have end organ damage or organ failure. Yes.
Okay.
So what happens is, sepsis, it starts from sepsis, then it gets to severe sepsis, and then you can also get to septic shock.
Okay.
And all of these things are usually just terrible, terrible, terrible. Yes.
Okay.
Yeah.
How do you know you have sepsis?
How? It starts from now a simple bacterial infection, and then say you had an infection from your lungs, and then from there, the infection has spread into your blood.
Yeah.
And then now, all of a sudden, now this pneumonia that you had, you cannot even have enough strength to even walk. You feel your heart is beating faster.
Yeah.
You have, you are breathing faster. Your extremities are getting colder. You are feeling very weak. You feel like you cannot even tolerate whatever is happening. And then it can even go to a point where now your mental status has been altered. Instead of you being the way you are, now you feel like your level of consciousness inaanza kushuka chini kidogo, and instead of just being like a normal human being who talks the way normally talk, now even sometimes the speaking gets to be difficult. So when we see you have altered mental status, when you see all these other signs are coming up, and then it starts from even your blood pressure getting very high a little bit, and then it gets to be to the point where it gets lower and lower and lower. Now from there we now diagnose you with sepsis, and then apart from that we do the necessary blood tests to at least try and diagnose, which is at least confirm. So we think of it clinically, and then we do the blood test to be able to confirm. Yeah.
Okay.
The most common one is usually a full hemogram.
Yeah.
And then now, if you are thinking of sepsis, now we'd be more interested in a blood culture, because by the time it gets to sepsis, the infection has gotten severe. We'd want to put someone on specific medications to help the specific bacterial infection or the fungal that they have. So now with blood culture, blood is removed and then it's tested, and then they get to know ni bacteria gani hiyo. But it takes time. But in the meantime, the patient is started on some good antibiotic. The patient is given fluids and a lot of other things to at least help.
Okay.
Yes.
That makes me think about COVID. That would be the most relatable. Well, is that because I saw how COVID was manifesting? That it would start very simple. Then kidogo, all the symptoms you say would now manifest. Is it the same?
It's almost the same.
Okay.
Because now for COVID specifically, COVID was caused by a virus. Yes, and that is very important, because we have been talking about these other things that were caused by bacteria. But now COVID is caused by a virus, and now you start having all these signs and symptoms. Now unalemewa, and then now your organs also start failing. And there are some critical organs that when they fail, that's it.
Okay.
So now if you get diagnosed with sepsis, unaweza anza from kukua admitted in a normal ward, alafu kidogo umepelekwa HDU, high dependence unit, kidogo mtu apumui vizuri, uko ICU, and tunaomba Mungu at least despite medication. So bacterial infection or blood infection should be taken seriously.
Okay.
Yes.
I hear you. Now, Anasima, what are the symptoms of bacterial infections in the stomach, and how dangerous is the infection? Okay.
So now, in the stomach, you might, the common signs and symptoms someone might have, you can be having abdominal pains that is just generalized. Yes. And then you might be having episodes of loose stool, and then you might also be vomiting. So those are some of the signs someone starts with. Yes. And then now with time, it just gets worse. You are vomiting, unaendesha sana, you are getting dehydrated. Apart from dehydrated, the infection is also making everything else worse. Yes.
Okay. We have so many questions about stomach infections. Because I see someone else asking what are the causes of bacterial infections in the stomach. Now, let's just talk about the causes for the stomach infections, so that you would avoid them as well, because we have so many questions on that. So maybe you can just take it again. What are the causes of bacterial infections in the stomach?
Now, causes, they are very wide. And now there is the specific bacteria that cause, and then there's also how you get to acquire them. Yes. So specific bacteria, just to mention, at least the most common one, typhoid. The bacteria is called Salmonella typhi. It's among the most common causes infection in our in our abdomens, in our intestines. And then there is also Salmonella paratyphi, there is also Shigella, several other bacteria.
Yeah.
And now how you get to acquire them is if you eat at places that you are not used to eating. Yes. Places that you are not used to eating, for example, to mean umezoea unakula nyumbani, and then unaenda unakula kwa hoteli once. You don't know how well the food was prepared, the person was preparing it, alikuwa aje, if alikuwa na typhoid or not, or alikuwa na some other infection. So when you get to eat that, and now upate the infection, now things go south from there.
Okay.
Yes. So eating at places you don't know, eating at kukula vitu za street too. Yes, because you don't know how hygienically, how it was made. It is not, that's why at least if you go to a restaurant or kamahali wanapika, and you'll be more somehow assured of hapa hygiene iko vizuri. But if you go to the street, someone alikuwa anapika tu hapo kanda barabara.
Chukwanga pesa.
Yes. So it's not, that is probably the most common way. The other way is unasalimia watu kila mahali and you don't wash your hands. So before you eat, you don't wash your hands. And washing hands means you have to also use soap to wash your hands. Yes, so someone anaosha mkono tu na maji haraka or nini, but when you use soap, it actually makes sure that any other thing else iko kwa mkono imetoka.
Okay.
Yes.
Okay.
And then the other one is just personal hygiene. Hizo ndo zinasaidia.
All right.
Yes.
So you have to make sure wholesomely.
Yes.
Unaangalia hygiene vizuri.
Unaangalia hygiene vizuri, unanawa, and then usikule vitu za street. But now someone can come and say, hey, mimi nakulanga tu kwa street na sijai kuwa nayo.
What's the difference?
So now there is also something called bacteria tumbo yako imezoea. Yes.
Okay.
Yeah. So say you have been staying in Nakuru for a while, na umezoea kukula hizo, and then all of a sudden you go to say to Nairobi or to Kisumu, ukule huko alafu inakuharibikia. So now there is the general notion that the bacteria like around Nakuru, your body is used to them. Yes, hadi nazi consider easy. Ni normal. Okay. But then now when you go to a different place, now it inaleta shida. Okay. So that is what we usually call traveler's diarrhea. So if someone was just traveling na akule somewhere mahali meli hajazoea, and then atakuwa na nini, because now there is a change on the bacteria now.
Okay.
Yes.
And now for that, would it cause food poisoning?
Now, food poisoning by itself, it's different because food poisoning does not involve infection by the bacteria. For example, now with typhoid, the bacteria, Salmonella typhi, inatoa toxins. Yes.
Okay.
Now, when you get food poisoning, need the toxins ume-ingest. Yes. It's not, you have not gotten the infection or anything, it's just the toxins ndio ume-ingest.
Okay.
So probably mwenye alitengeneza chakula ilikuwa na typhoid or nini, but mali ulisehemu ulisaviwa ilikuwa tu na the toxins.
Okay.
So now the toxins itafanya ukue na episodes of loose stool, but now for food poisoning, after kila kitu imepita, you're normal.
Good to go.
Yes.
Okay, it's not that you now get the typhoid.
Yes.
Okay.
Yeah.
Sawa. So food poisoning wouldn't cause blood infection or stomach infection at any point? No?
Yeah, it will not cause blood. It will not cause blood infection.
Okay.
Yes.
I see. Anasema good morning MBCI. Good morning too. Anasema my 5-month-old baby anajisugua uso sana mpaka nimediscover small pimples like zile za measles, and on the right cheek imeharibika kabisa because inatoa maji. Could it be related to any kind of infection?
Now, when it comes to things to do with the skin, and especially watoto, now you need to get that child checked out. Mpeleke hospitali, aangaliwe vizuri, waone what is up. Because if there's something else imeanza kufura hapo, there's probably some infection or something, or some skin issue. Yes.
Okay.
Unafaa kupeleka hospitali kachunguliwe. Yes.
Sawa. Asante sana. Now, let's talk about the people who use herbal medicines for their issues. Could be blood infection, could be typhoid as you said, especially with parents. They're so used to, ninajua kuna mmea fulani, that will help. Is it always good? Does it always work?
So now, with the herbal medication, assuming kitu iko ndani ya hiyo herbal medication inafanya kazi, na hiyo tunaipea benefit of doubt, assuming inafanya kazi, these herbal medications are usually not filtered enough. So for example, if you get Panadol iko filtered, ni hiyo Panadol iko ndani, ni paracetamol iko ndani, na it is just that. But now this herbal medication, it's not filtered. Itakuwa na some other things else apart from the active ingredient yenye inafaa kusaidia, assuming it works. Now all these other things ukishazi ingest zinahitaji kutoka from your body, and then now it's your kidneys and your liver that are going to be damaged zikijaribu kutoa all these toxins zenye mwili hazijui ku get rid of. So you'll find a young person probably 9 years old or 17 years old ameanza kuwa na kidney failure because anaenda dialysis. Why? Because mzazi amekuwa akimpea tu just this herbal medication to the point now imeharibu figo to a point of no return. So my take on herbal medication, assuming inafanya kazi, assuming inafanya kazi, it doesn't always work, but assuming inafanya kazi, don't use, because now you are risking your other organs. Just go to a hospital, you'll get medications and zitasaidia.
And is it also the same for people? We've talked about people who like to self-medicate. And they self-medicate, it doesn't work. They change the medication for themselves. Again, Dr. Google, it doesn't work. What would be the long-term effect of that?
Now, the long-term effect of taking medication, like una Google, alafu una take medication. Now, there is something called antibiotic resistance. So for example, umezoea amoxil kila mara, unakohoa amoxil, or nini, you go get azithromycin. Those are some. Or tumbo inauma, you get Flagyl. So that point, it will come a day when you will now actually get an infection that your Flagyl ingetibu, that your amoxil ingetibu ama azithromycin. But now you find it's not working. Why? Because mwili yako imeanza kudevelop resistance against it, so it will not be working at all. So unapata mtu tumbo ameendesha, amezoea tu tumbo ikimsumbua ni Flagyl, and now all of a sudden hata ameze aje haimsaidii, or afanya aje haimsaidii. So on self-medicating, my opinion is ona a professional. Ona a professional, upewe dawa zingine zinasaidia, and then you'll be okay. And also on kuangalia Dr. Google, hey, Google can make you even panic further. For example, if now you have a very severe headache, and then you Google search causes, among hapo watakwambia brain cancer and several other things. Or ukikohoa sana hapo wataangalia waseme TB, or waseme lung cancer or something. Yes, these are things zenye ziko, but pneumonia tu uko nayo, or uko dehydrated, that's why you have your headache, and now you start panicking. Hey, naweza kuwa na brain cancer, naweza kuwa na this and this and this. So emotionally on your part inasumbua. So don't, in as much as we are in a world of knowledge and you have easy access to this knowledge and sources of easy, also go see a professional. At least itasaidia.
Now, let's talk about antibiotics resistance. So for someone who has acquired resistance against antibiotics, and they get blood infection, how do they go about it? What can be done?
So now, how we get to even know that someone has antibiotic resistance, utapata someone umemtibu leo, umemwandikia very good medication. Tuseme alikuwa na pneumonia, infection kwa kifua. Umempea very good medication. And then this person comes back after 2 or 3 days, anasema doki kitu haijanisaidia. And then now you give another one, anarudi back after another one day, anasema hey doc, hizi vitu hazisaidii. Yes, I'm getting worse and worse. So from that point you start thinking there's probably some resistance there. So you advise the patient, maybe we admit you to kupe some good medications as we monitor, but now during that time is when we do a blood culture and sensitivity. So tunatoa damu, alafu inaenda inapimwa, and then whatever bacteria watapata they try and compare it to all these antibiotics kujaribu kuona ni gani inasaidia na ni gani haisaidi.
Okay.
And then now tunapata majibu, so tutapata most of the medication tulikuwa tunapeana mtu ako resistant to them. So in such a person unaambia if you ever get sick, beba hiyo karatasi hiyo blood culture result, onyesha daktari wako akupe something yenye itasaidia. Ndio asikupe zenye hazisaidi. And nowadays is so bad, you'll find a young kid 3-4 years amepewa almost kila antibiotic, akikuwa tu na kajoto kidogo antibiotic, kanini kidogo antibiotic. So by the time anafika 4, 5, 10 years, we cannot use all these common antibiotics for something simple as tuseme tonsillitis. Yes.
Okay. So you need to do better there.
Yeah. So at least make sure you don't self-medicate the child. And then if kuna bacteria mtu amezoea kutumia sana, not bacteria, sorry, if kuna dawa mtu amezoea kutumia sana, at least ikue hiyo na at least a healthcare professional asaidie in the mix. Yes.
Wonderful. Nasema, good morning guys, I have a problem with my mouth. Every morning nikiamka, my stomach and my mouth ni uchungu sana. Hata nikikula something sweet before bed, bado ni uchungu and I'm not sick. What would be the problem?
So stomach and mouth ni uchungu. Yes. Hapo kwa mouth probably unaweza kuwa uko na some ulcer or something kwa kidonda or something hapo, or inaweza kuwa shida ya meno. So you need to go get checked out. For now your tummy, if you have severe pains kila mara pia unahitaji kuenda kuangaliwa, probably you might be having ulcers. That is the most common thing inaleta mtu tumbo iume kila wakati. But you need to go get checked. Fika hospitali upimwe uangaliwe, alafu uwekewe dawa vizuri. Yes.
Okay. Asema, is eczema a form of blood infection and how can it be treated permanently?
Okay. Eczema is not a form of blood infection. Eczema is a form of a skin infection. Yes, or a reaction on the skin. So now, treating it permanently, you know, it's like having eczema is like, say, malaria. Ukipata ndio inatibiwa, and then you have a chance ya kuipata tena, alafu inatibiwa. So there is no like treating it permanently kabisa. So if you have eczema, uende uone daktari uandikiwe those creams zitasaidia, upake, if iishe, bas. And then you might also get eczema again. It's not that ukitibiwa mara moja, that's the end of it. Yes.
Okay. Now, what would be your parting shot on our topic today on blood infection?
Okay. Parting shot. Blood infections are, the topic by itself is very wide, and it's tied up with all these other infections mtu anaweza pata. So if you have an infection and you are in the risk group, yes, for example, the risk group, if someone younger than 2 years and above 65 years, if you are immunocompromised, if you are on chemotherapy medication, if you are on this medication like prednisolone, then zinaleta shida. If you have even a catheter or any foreign body iliwekwa kwako, yes. When you start getting sick, or even if you have diabetes, when you feel hii siko vizuri sana, go get checked as early as possible. Yes. Go get checked, upimwe tu. The most common test inaitwanga full hemogram. It's very simple, it's not even that it's not even expensive. Go get tested, at least tuone, and then you get given medication mapema before it gets worse. And if you feel it's not like hauko vizuri, fika hospitali, angaliwa. It's just the basic tests, and then you upewe medication before it gets to sepsis, na ifike to septic shock. Yes.
I see. Now, for the people who've had you and they'd like to come get checked, or, you know, to just ask more questions and know what the problem is with your bodies, watakupata wapi?
Mimi watanipata Valley Hospital.
Where is it? Directions.
Yes. Hey, hapo sasa.
Nakuru.
Iko Nakuru town. Iko karibu na West Side Mall. Yes.
Okay. Sawa. So of course watu wa Nakuru mnajua West Side Mall. So kwa West Side Mall with directions as well. So ukiwa West Side Mall unateremka tu right there, it's there. So karibu na West Side, ukiwa West Side uko Valley.
Yes.
Yeah, Icon Valley. So thank you so much for being here. And of course, the numbers are on the screen. So if you need to get treated, if you have any questions, please make sure you reach out to them. The numbers are there, and you can always get help. Once again, thank you so much for coming.
Yes.
This has been an informative session. And I know that you have learned as well. You've learned quite a lot from this particular session. So make sure you send in the links to your people, your friends, your family, as much as you can, so that they'd be able as well to just learn from what we have learned today. And that will be very important. Once again, asante sana for tuning in. God bless you. God be with you. Now, we will be getting the Did You Know segment. Of course, ukiona Did You Know, unajua kwamba tunaenda kumaliza kipindi ya leo, so that we can now have music and, get to digest what we have just heard today. Now, our Did You Know today says that, did you know there's a 3,400-year-old song? All right, the Hurrian hymn number 6. Twende tuitafute tuone. It's 3,400 years old. Who was there? Who wrote that song? Martin Mato.
And it was BC, before Christ.
Imagine.
Yeah.
Yeah, so we get the Did You Knows from Martin. Now we'll make sure we ask that question tuone ni nani ndo aliandika that particular song, just to understand more about it. But go check it out. It's the Hurrian song, hymn number 6. Yeah? Yes. So go get it checked out so that you can learn. I don't know where we're gonna get the tune, but we will try and get the tune as well. Once again, thank you so much for joining us today. We've had an amazing session, and I know that you've learned a lot from today. So please make sure that you send in the links to your people, as we had said. Just to remind you, this has been Afya Clinic. We're here every Wednesday, all right? From 7:30 to 10, we have music in it. We have particular segments that are very informative to you, and we have doctors on board where we get to talk about everything that affects you as a person. So if you have any question that you'd want to ask, this is always the place for you. So if you have also any topic that you'd want us to talk about, this would be the place for you. So our numbers are always very open and ready to hear from you. That is 0721 105 105 on WhatsApp. So for this particular one is that you'd want to hear from WhatsApp. Na ukituma message tutaipata. Yeah, message tutaipata. Just text in either on WhatsApp or normal SMS. Ukitext pale, we'll be able to just hear what you want us to talk about, and we will consider it for the next session that you're having. Today we've had Dr. Rogers. Asante sana once again for coming. We have had an amazing session. Now we'll be having music. I love to tukimaliza by 10 a.m. But just to remind you is that, of course, being a Wednesday, is that at 12:30, from 12:30 to 2:30, we'll be having our lunch hours right here at Kingdom Seekers Fellowship Church. So if you are in Nakuru or its environs, make sure ukuje so that we'll be blessed together. God bless you. God be with you. Have an amazing rest of the day. Bye-bye.
Kumbushe